Hi, my name is Nicole Castro, and I will be talking about how the demand for long term care services continues to increase as the population ages in the United States. In 2010, 40 million Americans were aged 65 or older. By 2050, that number is expected to jump to 88 million. Among these older citizens, only 3 in 10 will never receive long term care services. I will start by defining long term care, which refers to a continuum of medical care and social services designed to support the needs of people living with chronic health problems that affect their ability to perform everyday activities. Long term care services include traditional medical services, social services, and housing. The primary goal of long term care is to prevent deterioration and promote social adjustment to stages of decline. While acute care is usually confined to specialty providers, the providers of long term care are more wide ranging. They include traditional medical providers such as physicians in hospitals, formal community caregivers such as home care agencies, facility providers such as nursing homes and assisted living facilities, and informal caregivers such as friends or family members. In the U.S., while the government pays most of the cost through Medicaid, patients and their families contribute a substantial amount as well. Few people purchase private long-term care policies, many in the mistaken belief that such care is covered under their general policies or by Medicare. Others find policies too expensive or decide the benefits they offer are too limited to be worth the cost. One result is that the total of the U.S. long-term care spending in 2011, 21.5% was paid directly by patients or their families, most often by patients' spouses or adult daughters. With cost of long-term care ranging from $6,000 to $10,000 a month or more, planning to address that risk is a smart move. One solution is long-term care insurance. A policy can protect your estate against the impact of extended medical or rehabilitation services. However, the cost of insurance may have you considering taking your chances, quote unquote, and letting Medicare or Medicaid step in once your resources are depleted. If you think long term care insurance is right for you, remember that coverage costs less when you are younger. Premiums are based on your age and health and tend to increase past age 60. Another cost saving move to consider is a shared care policy with a combined pool of coverage that you and your spouse share. We all know that aging is going to happen to all of us, regardless of what we believe along the political spectrum. Public policy may help to clear some of the challenges that have existed in creating low-cost viable products, helping to think about ways to create better access to those low-cost products through work or other kinds of choice options. Also, there's a real need for public policy to help educate people about the fact that we're all going to get to this place where we might need a little bit of help in our lives. And it really isn't about the scary discussion of you could end up in a nursing home. It's about the positive discussion that for all of us, a little bit of help may be necessary. And we're going to want some say and control over that, and we need tools to make that possible. First, a new tool set needs to be available, and it needs to be available to people that are working so they have enough time to participate, to save, to create a large enough insurance pool to be able to manage the kind of risk people will face over time. You need enough time to build a product, get the product out there, and give folks the time to pay into it. And 5 years is about as fast as anyone could imagine doing that. The idea is that we have so many boomers who are nearing retirement, and if you wait more than 5 years, the majority of boomers will either be retired or be within 5 to 7 years of retirement, and it will be hard for them to save. They will then need to use the currently available mechanisms, Medicare and Medicaid, or some form of long-term care insurance. The other reason is the demography of the country is really changing. We are going to reach a point where there are going to be many fewer workers. Families are going to be smaller. There are going to be fewer people to rely on to do the caregiving for mom and dad as we watch the boomers move through their retirement and into their older age. So the opportunity is now to put in place some solutions and still leave enough time for them to have really meaningful impact on people and their families. Discussion question number 1. Older residents of long-term residential care often with complex comorbidity, are frequent users of hospitals. What do you think are some ways to reduce admission rate for common conditions? Discussion question number 2. When you're looking at your own long-term care in the future, what plans are you making and what have you thought about for yourself? Thank you so much for your time, and I look forward to seeing your responses in the discussion board.